the opportunity of financial resources independent of national politics. So there 17 sides at the end of our national security problem. And I will tell you how.
The organization has. So we're talking about how the board behaves, or in some cases, how they misbehave, because that also happens, rather than the tax they make.
Very rare environment that I know.
I tell you, I've secured the name and content. Hello there. Welcome to this episode of ICAN on Air, your iconic educational enlightenment and interrogating series of the Institute of Chartered Accountants of Nigeria. Today, our flight lands us in not too hardcore professional area, albeit all the same importance, and that is health. We do say health is wealth. And we are going to be looking at the topic oral and general health, what professional accountants to know, should know. It is trite knowledge that the way to the heart, the way we breathe, and our overall general health is dependent on what goes on orally through our mouth. And taking care of that is not only a matter of importance, but sometimes people get careless in that process. And so we have decided we're going to bring in a professional, a dental surgeon, to come and help us throw insights into this area so that we may be reminded, and for those who don't know, can gain an understanding of the deeper knowledge of how it should be. And so on our question and answer segment today, I have on Dr. Fechi, who will be coming in to throw light into a few questions, general questions that professionals do want to ask. Dr. Fechi is with the UCH in Ibadan Child Health Care, and she also runs a private child oral health clinic in the outskirts of Ibadan. She is a fellow of the West African College of Surgeons. Presently, she is the secretary of the Dental Association of Oyo State in Nigeria. We will be unveiling Dr. Nkwocha to us very shortly. Also, on this segment of the program, we let you into our ICAN diary, a few announcements, tits and bits here and there. So don't go away. Stay on, stay put. We will unveil Dr. Fechi Nkwocha to you very shortly.
As a finance professional in a disrupted business landscape, what does it take to be in demand? What does it take to attract great paying international roles? If you're an ICAN member, it'll just take one exam. That's all it takes to complete the globally recognized SEMA professional qualification and the internationally respected CGMA designation. As a SEMA member and a CGMA designation holder, employers will look at you as a finance professional, constantly acquiring new skills to add value to the business. That's why they'll be willing to pay premium to hire and retain you. If you have 5 years of relevant experience and are an ICAN member, you can directly sit for the final exam of the SEMA Professional Qualification, the Strategic Case Study exam. Start studying the SEMA Professional Qualification. Prepare to make an impact.
Please join me to welcome Dr. Fechi Nkwocha to ICAN on Air. Dr. Fechi, you are welcome.
Thank you very much, Mr. King, for having me.
Excellent. Yes, always a delight to have our professionals come to enlighten us and give us education. And today we're looking at oral and general health, what we professional accountants and friends of the professions should know. And in framing the way I like us to go about this, so that the whole discussion can be put into boundaries, I like you, Fechi, to tell us what is oral health and what its relationship to general health. Are they one and the same? Yep.
Thank you, Mr. Fatimpe. Thank you for having me in this presentation or radio program to talk to professional accountants. And accountants are people we work closely with if we have to keep our money. And I want to thank you for the work you do and for helping us be our best too. And oral health and general health, they're one and the same. But one way I like to answer this question is I ask, is your mouth part of your body? If it is, then it is part of your general health. One would not be said to be generally healthy if the mouth is unhealthy. And in the mouth, we have not just teeth, we have our tongue, we have the lips, we have the gums, and other structures that support the teeth that we may not even see with our naked eyes. And all these things are channel connected to the same heart, to the same brain, to the same nervous system. So taking good care of your mouth means taking good care of your general health. So they are related. Every part of our body is connected, and we cannot disconnect parts of the body. We may talk about it specially so that we can give our people knowledge, complete knowledge about that area of the body, but it's not detached from the body.
Excellent. It's easy for us to just take it. So my mouth is part of my body, so naturally it should be part of my health.
Yes,
But
sir.
then, what are the objectives of oral health if you put this in relation to general health? And is oral health a function of discipline or some form of esoteric knowledge, or is it of both?
Okay, sir. That's a very good question, sir. The purpose of oral health, the purpose of making sure that one is healthy even in the mouth, is to make sure, like I said, no part of the body is left behind. And like we like to link oral health and general health because we say many times the mouth is the mirror of your body and is the gateway of the body. So the purpose of oral health is to make sure that the mouth and the body in general is free of disease, and people, the populace generally, acquire knowledge of how to keep and maintain oral health. It's not abstract, it's not something beyond us. Most things that one should do to maintain oral health, which we're going to talk about, I believe, later in the segment of this show, they're not things beyond our reach. But like you said earlier on, sometimes we get carried away, sometimes we get careless. And many times I tell my patients that God protected the mouth with several layers of protection, because once you're unable to eat, you're unable to sleep, you're unable to go to work, your blood pressure begins to go up, you begin to be uncomfortable, you begin to lose weight. So before one gets to the level of having oral diseases, if you have to wait for the disease to show up before getting to know about the disease, before getting to know how to prevent it, before getting to know where to get help, then you find out that a lot of us would not be able to perform the jobs and the functions that we do. So the purpose of teaching about oral health, the purpose of teaching about letting people know about oral health, what they can do to maintain health, what they can do to prevent disease, what they can, where they can go to obtain help, is to make sure that at every point in time we are functioning at our optimum, because every part of our body, including our mouth, is healthy.
Hmm. So it's settled that we have oral health diseases. Hmm. Now, these oral health diseases, what could be the possible causes and what would be the preventions?
Okay, that's a very beautiful question, sir. There are some are more common than the others, and I know many of us have heard of toothache and gum disease, bleeding gums, and all that. I'll mention others as we go. These diseases have been with man since time immemorial. Since the beginning, since the creation of the world, people have always had complaints of maybe a bleeding gum, pain in the tooth, pain in the gum, a wound in the gum, swelling in the mouth, or bleeding in the mouth, or sometimes bad breath, bad odor from the mouth, scattered teeth. I'm using terms that people use every day to complain about issues they have in their mouth. And as different as our faces are different, so are our mouths different. And even though sometimes people say, oh, I have pain, the source of the pain in each person may be different, because, like I said, there are several different structures in the mouth, and each of them are alive, and they are connected to the heart, to the brain, to the system, to the pain system in the body. So different things may be responsible for this thing all complain as pain. So because of that, it is pertinent for people to meet with professionals to find out exactly what is the cause of the pain, where is it coming from, and how best it can be treated.
Hmm.
So the common oral diseases, I like to talk about the ones that are very common in West Africans. Gum disease. Sometimes we hear that our teeth fall off when we are babies and then we grow adult teeth. By the time we are getting old again, they shake and they fall off. My brother, it is due to disease. We are actually supposed to carry our teeth back to God. Gum disease is the biggest cause of shaking teeth and people losing their teeth in West Africa. Africans are known to have very bad gum disease. Many times it starts without pain. There are other symptoms, but no pain. When gum disease begins to give pain, it has gone beyond, help. So that's one, I put that as number one because it affects Africans a lot, followed by tooth decay and gum disease. Tooth decay, you come sometimes with bleeding. By the time pain sets in, then a lot of damage has been done. If treatment is not done at that point in time, then you can have swellings with pus, discharge, and sometimes this can spread very far into vital organs in the head and in the neck and down to the chest. And their end results many times is not palatable. Many times they can end in death. So the reason we treat, the reason we keep talking about oral health, the reason we keep talking, go check before it gets to the point of a disease, go check before it gets to the point of pain, is to preserve life, first of all. Because many times we have people who come in, they say, oh, I didn't have pain. I just woke up one day with a swelling and I thought the swelling would go down and now I can't breathe. So those are things that we see commonly, and I would like our people to watch out for. Okay, there are other problems. We have sometimes which are which we see a lot these days. Some other things that may be responsible for it, but I don't want to go too deep into it now. I'm not into a scientific session. We have some tumors in the face, in the jaws, and you have some people having scattered teeth that are prone to tooth decay and gum disease. You have people who are involved sometimes in accidents or some other unfortunate events, and you have them losing parts of their teeth and parts of their lips or faces, and those have to be taken care of. And it's the dentists, the maxillofacial surgeons that take care of that. Sometimes you have children who are born with a defect in their face or in their lips, and that comes with a lot of problems. But those two are treated, and the babies can live very full lives. Babies that with parasites. So those are some problems that come with that the dentist sees, oral problems that people are faced with, and we have to help them with.
Okay. Thank you very much. And whilst we are on that, from your experience as a dental physician, just curious to ask if there is a link between some professions and some sicknesses. Any medical research or discovery in that direction?
That's a good one, sir. Thank you very much. First, I want to address professional
Uh, so we seem to be
all
having
right.
some
And
freezing.
what affects most human beings will affect even the accountant. So for the accountant, well, there's no disease that afflicts accountants, no. But if they find themselves Mr. Akin, particular problem that peculiar to accountants, maybe because as a result of habits that they engage in, we
Yes, Obviously, we seem to be having a bit of freezing from Dr. Nkwocha, but I know she will soon join us. But this far, yeah, for our profession, there's no scientific basis of saying we are prone to heart attack. Heart attack can happen to all and sundry. We'll try and link back with Dr. Nkwocha, and whilst we are that, we go on a short break. Please don't go away. We will soon be back.
Let me start this speech by expressing my profound appreciation to the Almighty God for making this day possible. Today marks a significant milestone in the accountancy profession as its foremost institute on the African continent. The Institute of Chartered Accountants of Nigeria bestows on me the mantle of leadership as its 58th president. I'm greatly honored by your esteemed presence at this unique and seamless transition ceremony, especially organized to formally present to me the insignia of office following my unanimous election by the ICAN Governing Council at a special meeting held on Friday, April 1, 2022. Accepted. It is therefore with humility, great sense of responsibility, and a determination to selflessly serve that I, Tijani Musa Isa, graciously accept my election as the 58th president and flag bearer of the accountancy profession in Nigeria, as pioneered and represented by the Institute of Chartered Accountants of Nigeria. Given the values cherished by the Institute, the accountancy profession, and the enviable antecedent of our founding fathers, I promise to hold this great position of trust and responsibility unanimously reposed in me by my professional peers. As your primary inter pares,
Yes, you are welcome back, Dr. Fechi Nkwocha. You can hear me clearly?
Yes, I can. Thank you very much, sir, for having me back.
Okay, all right.
I'm sorry for the outage.
Oh, it's okay. That happens. So you are saying there is absolutely no link between certain professions, ours inclusive, from research and a certain.
No, I said there's no particular problem that is specific to accountants.
I see.
All right, but there are other professions who may be predisposed to one problem or the other. And I was trying to make a case. I was trying to make an example of what we see sometimes in tailors or certain people who have the habits of putting objects in their mouth, in between their teeth. They end up wearing out their teeth. Sometimes they wear it so thin that it breaks. Sometimes they put it in between this, what we call AG, the gap, the front gap in the front, and they end up widening the gap and causing gum disease and shaking teeth. Sometimes the teeth begin to shake and fall off. Sometimes they break. All right. Yeah. So it's the habits that people engage in that can predispose them to certain problems. Then sometimes we see people who are working in restaurants or bakers who have to taste and eat a lot of sweets, sometimes coming down with holes. But it is not peculiar only to bakers. We don't see holes only in bakers. We don't see gum disease only in bakers. And if these people take adequate care of their teeth and take instructions and get education like we're giving to the accountants right now, they will not fall into such categories. But particularly for accountants, there's nothing that predisposes them to oral disease just because they are accountants. But like every other person, I said they are human beings first of all. Anything that affects human beings affects them. And once they are armed with the knowledge on how to take care of their oral health, how to maintain oral health, where to get best oral care, what practices to engage in to get to maintain oral health, they'll be as fine as every other person.
Super. So more of habits, more of stereotypes, not just for our professions and other professions.
Yes, sir.
But Dr. Nkwocha, I can tell you that many professional accountants are always under stress. Of course,
Mhm,
you've got to meet
mhm,
targets like
mhm.
some other profession, but with us, time, or what we call cutoff,
Time.
is always a very,
Yeah.
very important thing. Now, in your practicing as a dental surgeon, of
Yes, sir.
course, a person with that kind of case comes to you, is under stress, and perhaps have to undertake some surgery and stuff like that. What kind of pep talk do you have to say to them? And then, after a successful surgery, what kind of encouragement are you going to be giving to
Advice.
this set of people who are so prone to stress, like those of us in that profession?
Yes, sir. Thank you very much for that question. So that's apt. Yes, I know accountants can be stressed, especially when they have to, when they're working with big organizations and they have to meet up all the numbers, or some of those numbers that we are unable to fathom. But it all comes down to the balance, the life
Mm,
work balance. See, my brothers, my dear accountant brothers, I beg you, take care of you. Take care of your health. Accountants know better than anybody else that what it means that prevention is better and cheaper than cure. You know
mm,
that.
mm,
You know what it means that the 1 naira you refuse to spend today can cause you to spend 100 naira tomorrow. No other professional understands this as much as the accountants, because
mm,
I know how they advise us and how they help us to spend 1 naira today and save 100 naira in the future. And when that comes to your health, Mr. Akin, like you said, health is wealth. Your health is your greatest resource.
mm, mm,
That's what I would tell to anybody, an accountant who is under stress. Your health is your greatest resource. And
mm,
stress, when we allow it, stress is actually useful. You need some amount of stress to push you, to make you try to aim high, to make you want to achieve, to make you want to do some things that you wouldn't have done if you were all laid back. But when it is out of proportion, when it is overwhelming, when it's more than you can manage, it can actually lead to depression. And once that comes in, it not only affects your oral health, it affects your general health. And once
mm,
that is affected, you're unable to function at your best, and you're unable to be that accountant, that professional that we want you to be. So the first
mm,
thing I would tell an individual who is stressed is take care of yourself. One
mm,
who is not healthy is not going to be productive.
mm,
And
mm,
just like you have to meet targets, that means you have to set timelines, and you
mm,
have to set priorities. You have to make out time to sharpen the axe. You have to make out time to sit back, to to rethink and re-strategize. And health should be made priority, because it's your greatest weapon. The fact that you
mm,
can get up in the morning, throw your arms and legs, means you can work. So when
mm,
it comes down to oral diseases, one who is stressed, let me take this back to the problems we see in professions, but this is not particularly about professional. Like I said, it's about habits. People who are stressed sometimes tend to grind, because they begin to, it's part of what we see, a symptom of stress, grinding. And if that goes on for a long time, they wear off the surface of their teeth, and they begin to have sensitivity. And then you find out that, like I said, it becomes a diminishing returns. So he's working hard, stressed to meet up targets, and then he's beginning to engage in habits that are damaging, not just to his oral tissues, but to his whole body. And then he begins to have problems, and he begins to complain. Oh, I can't eat. Oh, I'm in pain. Oh, I didn't meet up that deadline because I couldn't get up. I couldn't sit up. I was having pain in my jaws. I was having pain in my teeth, because he hasn't taken out time to sharpen the axe, to relax, to re-strategize. So what I'd ask the individual is this: take out time, break that cycle of stress. We all have our leave. We all have time to take off with the family. So please take some time off work. Your job needs you to be healthy. Take some time off. Take some time with your family. During that time, schedule an appointment with your family dentist, with your family doctor. They will be able to check you. They will be able to check your blood pressure. They'll be able to check your blood sugar and do other general tests for you. And your family dentist or family doctor can always schedule a time that is convenient for you. I know people who work outside, who schedule appointments outside work hours. Sometimes they open as early as 6 o'clock to make sure they attend to their patients who have to be at work back for 8 o'clock. Sometimes they schedule appointments for 7 p.m., 8 p.m. I know people who work like that. I do that sometimes for my clients. So you can take advantage of such situation. You can take advantage of your leave. Please take your leave. You know what it means to prevent problems, and you do not want to have problems with your health, because your health is your greatest resource. If no matter how intelligent you are, no matter how bright you are, no matter how he's the only one that can solve the problem, the moment you can't get up from your bed, the moment you're bedridden, sorry, somebody else takes over. So please take care of you, take care of your health, put it first, and then every other thing will fall into line, every other thing will fall into place, and you will meet that deadline faster. You would even be able to achieve, to reason and think faster, and more sharp and apt manner, and achieve whatever height it is you want to achieve as a professional.
Thank you very much, Dr. Nkwocha.
Thank you, sir.
Just joining in, this is ICAN on Air, and we are looking at the topic that is shown on your screen: oral and general health. All professional accountants should know. We'll be fielding questions to Dr. Fechi Nkwocha, a dental of repute, and she's been breaking some of these things down for our understanding. Now, Dr. Nkwocha, back to basics again. What would you say are the early signs of dental problems? And is this genetic in any way? I'm asking because some people send out foul mouth odor, regardless of the kind of toothpaste or mouthwash that they use. Yeah.
Well, that's a very brilliant question, sir. Thank you for fielding that, because you see, like I said before, dental problems, oral problems is not one thing. As our faces are different, so the things in our mouth are different. So the things that can cause problems in our mouth are different. But I'll try to list the common ones. Tooth decay, for example, let's start with that. That's what people express as holes in their teeth. It is caused mainly, I like to say it's caused by neglect. And before a hole forms on the teeth, it would have taken at least 2 years. And these holes are caused by an interplay of certain factors. There are some germs in our mouth. God made them all. That's their home. That they live there. They don't have any problem. All right. There are some on our skin. There are some in our ears. There are some in our eyes. That's their normal habitat. But the ones in our mouth, we give them food. And anything that eats food, anything that takes in, also does output. And the waste of these microorganisms are acidic. They are acid. And it is that their acid, when it stays on the teeth for a long time, that dissolves the teeth. So you can imagine the amount of acid that microorganisms would have generated in the mouth to cause decay. We advise our patients to see the dentist 2 times every year, every 6 months. So before one hole develops, I said it takes about 2 years. And during that time, one should have seen the dentist 4 times. That's the reason why I said what causes holes in particular is neglect. I talked about the microorganisms. Those microorganisms, they eat remnants of whatever it is left in our mouth. And the way we like chocolates, ice cream, I'm talking about myself and every other person who loves ice cream like me, as we like them, that's the way those microorganisms like them, because they digest their sugars very easily. So the microorganisms, the sugars, our teeth, our tooth surfaces, and the time that we leave these things to stay in our mouth is what causes to decay. You know, I said it's an interplay of different things. So when these are interplaying, there's a lot of microorganisms in the mouth, bacteria in the mouth, germs in the mouth. We give them food. We don't clean our mouth. We leave them there for a long time. Holes develop, and that's why I say it's caused by neglect. While these germs are in the mouth and digesting our food particles, they're leaving dirt in the mouth. Those dirt, we call them plaque. They leave some yellowish things on the teeth. Those things are the genesis of most oral or dental problems. Tooth decay, gum disease, because it irritates the gums. And the body, in the process of trying to take care of that irritation, there's even more injury. And then from the gum disease, you begin to have tooth shaking. Then from all these things, you can begin to have swellings on the jaw. And those swellings are just pus accumulation. You can imagine pus in the jaw. And like I said, it can spread to different areas of the body. It can spread up into the brain. It can spread down into the neck. Like I said, sometimes you have people being rushed into the emergency room. I can't breathe. Oh, my tooth started paining me yesterday. And then today I'm having a swelling. You know, it's not, it doesn't happen like that. So that's the one of the causes, and these are the common causes of the 2 most common causes of dental problems. And by the time this has gotten to this level and one is being rushed to the hospital, we're no longer talking about the teeth. We're looking at how to secure space in ICU, how to make sure the person is alive, how to look for blood to make sure that the person doesn't die before we come back to the mouth to ask which tooth was the problem. Okay.
Fantastic. Real fantastic. Of course, we make pitches like other professions, and we have to gain the confidence of clients. These basic hygienic things, going back to making sure that we don't get careless and that we don't make certain things habits. But you know, professional accountants spend lots of time speaking in order to educate or guide their principals and clients. Now, what must they not ignore when it comes to oral health and care?
Okay, thank you very much, sir, for that question. You know, there's a saying we have that you brush your teeth in the night to keep your teeth. In the night, you brush to keep your teeth. In the morning, you brush to keep your friends. So you brush twice a day. In the morning before you go out, and last thing before you sleep. Last thing, when you brush last thing before you sleep, what we're doing at that time is making sure that we're ridding the mouth of whatever remnants of the food we're eating during the day, so that there's not much for the germs that live in the mouth to work on. Because when we're sleeping, our mouth is closed, and we're not able to spit out or rinse out during this time, and that during those 6, 7, 8 hours of sleep, the bacteria have field day. So you want to make sure that whatever is left in the mouth is as minimal as possible. And when you wake up in the morning, you find out that the mouth will not well, you can eat, and after having breakfast, then you brush again, leaving your mouth free of germs or and food substances that the germs can act on. The accountant needs to not only have his mouth feeling tops, to make sure he has confidence to talk to his clients and other people that he meets on the way. So basic oral healthcare tips that I'm going to just share that quickly with you now would help him feeling good. And you know, when we talk and talk and talk a lot, sometimes our mouth tends to be dry. Have frequent sips of water. It helps you, it helps your mouth, it helps your kidneys, it helps you to stay generally healthy. Okay, so take frequent sips of water. Brush your mouth 2 times a day, morning and last thing before you sleep. While brushing, use a medium textured toothbrush. Medium texture, not hard. Yo, don't use smoker's hard toothbrush. Please, I'm begging you, because you end up causing problems for the teeth. You know, sometimes you have people who come in, their teeth are very clean. They are so clean, they have washed off the teeth. There's no more teeth. They have, like, you know, when you're using iron sponge to clean pots every day, there's no more, the hot pot begins to leak. So please, medium texture toothbrush, take frequent sips of water, see your dentist 2 times a year. They'll make time for you. Look for the schedule the time that is convenient for you and see them. Make sure that um, your oral health is taken care of. You know, you asked the question about our general health. There are many times that it is in the mouth that you detect disease. There are many times we look into our patient's mouth, and that's the first time they're learning that they are diabetic. Because there are certain things we see in the mouth, and we know that this is a sign of early diabetes, and we diagnose it, and the patient starts treatment on time. And there are times when patients who already have diabetes and are taking treatment for diabetes, if such patients, it is known, it's part of our management. If such people have really bad oral hygiene, no matter the amount of medicine they take, it doesn't work until that oral hygiene is taken care of. Why? Because the body is trying to fight a lot of infection. Imagine that we have 32 teeth, and there are 32 of such infections, pots of pus here and there, and one is taking medicine for diabetes. Many times their physicians just wonder what is going on. But by the time you look into the patient's mouth, you say, oh no, this is a diabetes complication. Once that is taken care of, then you even find out that the amount of insulin or the amount of medication they need to take for their blood sugar to regularize is reduced. So for one to be able to live a healthy life, you must take care of your oral health.
Hmm, hmm, hmm. Very interesting. I want to get back to you on a statement you just made, because it's news to me. Like I'm sure it's going to be news to quite a number of people. When you said, for instance, that we should not use smokers' toothbrush, there certainly must be a reason why smokers' toothbrush was created. Maybe for smokers. So if you are not a smoker, you may not use. But if you're a smoker, you could use smokers' toothbrush. I wanted
If
just
you're
to
a
get a
smoker,
question.
I'm sorry to cut you short, sir, but thank
Oh,
you.
God.
If you're even if you are smoking, although as medical personnel would advise you not to smoke, because even the Ministry of Health puts the label on this packet of cigarette that smokers are liable to die young. And the reason is this: not only does the smoking affect your teeth, getting it stained and all, it's known to cause heart disease. It is known to cause lung cancers. It is known to predispose people to mouth cancers. It is known to pollute the air. So first of all, I would say try whatever it may cost you not to even start smoking. And if you're smoking, quit. But if you are still smoking, don't compound. You already you have 1, 2, 3, 4 problems that have been lined that this is likely going to be the end point. Don't add smokers' hard toothbrush to it. Instead, schedule frequent visits to your dentist. The reason however they manufactured, anybody can manufacture whatever they want, but is it everything that is manufactured that is good for you, that is good for the person? No, not everything. All right. The reason it was manufactured was okay, so it can get the stains out. All right. But in place of getting the stains out, it takes off the surface of the teeth. Those stains can be cleaned. Those things attract more stains. Those things attract more of the plaque I talked about, those bacteria and funny looking things on the teeth. Those things attract all those things and predispose a smoker to gum disease. Those things attract all other particles in the mouth, and it predisposes the smoker to shaking teeth. So you find out that people who are smoking, not just cigarettes, tobacco, shisha, funny things that other people can engage in social smoking, but it predisposes them to a lot of oral diseases. So not just for your oral health, for the whole body, disease from smoking. And if you are smoking, don't add tooth lesions, brushing off your teeth to the problem. You can see your dentist. Also, dentists run smoking cessation programs. They can also help to quit smoking for those who want to quit smoking. And while they are at that, they can help to make sure that you don't lose your teeth in the process and you don't brush off the teeth by using smokers' hard toothbrush.
Excellent. I have a question from Abdul Kabir Ojeng B.D.S, and I will read out his question. I will embellish it with one that I also have, since they are on the same page. It says, please, apart from use of toothpaste, what method can you recommend for proper cleaning of the mouth for people with yellow plaque? Now, let me add this. I know that in the rural areas, particularly, people talk about the use of the sticks, maybe water to brush and clean their teeth in the morning. And it's been with us, and I know it's still common practice till now. And in line with Mr. Ojang B.D.'s question, how hygienic is it? And as a dental surgeon, do you subscribe to it in any way at all?
Subscribe to the use of Paco, right?
Yes, the chewing stick, sir.
Okay, I will not condemn Paco because it's our own method of cleaning before we came in contact with the toothbrush. All right. Just like I would not condemn people who are riding camels before we came in contact with the aeroplane. Okay. So that was what was available then, and it helped them then. I do not think it will be in best practice to say, okay, leave your toothbrush. Let's all begin to use Paco. Now, the Paco was a brush. That's basically what it is. And what the brush does is to remove what we call plaque. Plaque in the beginning is soft. If you want, you can just run your hand across the surface of your teeth. One will be able to bring out some plaque. Plaque is always there. Plaque is always formed in our mouth. As far as we are alive, as far as the bacteria are there, the germs are there, as far as we're eating, there'll always be plaque. So it is plaque that the toothbrush removes. And just like broom, we have our local broom and we have our plastic brooms that we buy in the supermarkets, all right, it is not the broom that sweeps the house. It doesn't get up and sweep the house. You direct the sweeping how it should go. So you can actually use kpako to clean your mouth. But you see, those kpako of those times, sometimes they are so big, you may not be able to take it to the back of the mouth and clean those areas properly. We recommend to clean properly a medium textured toothbrush whose head is small, not the ones that are as long as your finger. If you find some people's toothbrushes as long as the finger, the head of the toothbrush is as long as the finger. You won't be able to take it to the back of the mouth. So they just end up cleaning the front and it doesn't go back to the back of the mouth to clean up the plaque in that area. Okay, so it is plaque that toothbrush can remove. But when plaque stays for a long time, that soft one, when it stays for a long time, it becomes hard. No toothbrush can remove it. That's when it becomes yellow, green, black, different colors. No toothbrush can remove it. You need to see a dentist, a qualified dental professional, to get it removed. Because inside that hardened black, yellow, purple, different colored things, they are just bulbs and masses of germs. They just sit there and cause tooth decay, gum disease, and all the other problems that can follow. And when they reach their maximum, it ends in ICU, and from there, you can go anywhere. But then it's easily removed by a toothbrush. It is not the toothpaste that does the cleaning, even though we will recommend you to use a toothpaste as dentists, just like we recommend you to mop your house with some detergent. All right. The toothpaste not only just cleans, it also adds fluoride. The toothpaste you must use must contain fluoride, because fluoride helps to fight against tooth decay and helps you to keep your mouth feeling fresh and smelling fresh. But first thing you need to do is to clean. We teach how to clean. I'm unable to. If I was able to send a video, I would have shown how to brush. But not only do you clean the surface of the teeth that we can see, you open and clean the areas under the tongue and on top of the teeth. The surfaces of each tooth, there are 6 surfaces on each tooth, and there are 36 teeth in the mouth. And you need to clean all of them. After using the toothbrush to clean each area, we also ask you to use a floss. This is to make sure we remove the soft plaque. But once it has hardened and become those funny colors, you must see a dentist. Kpako, yes, some of our kpako we know they're able to clean, just like the toothbrush will clean. But they have a disadvantage in that they sometimes they don't leave your mouth feeling fresh, but they can actually remove the plaque if you use them correctly. In those days, our grandmothers would just keep a very long kpako in the mouth, chew it until it finishes. It's not about the chewing. The chewing just makes the head soft enough for you to use it to clean all the surfaces of the teeth. And the amount of time involved in cleaning with kpako is longer, sometimes 6 times longer than using a toothbrush. So kpako is not evil. Kpako can be used. If you find yourself in a place where you need to use kpako, please use kpako with your toothpaste and clean properly. All right. For elderly people who have been used to kpako all their lives, we don't tell them, oh, you can't help you. You can teach them to clean properly using kpako. They take their time. Since they're not going to work anyway, they can spend the next 20 minutes cleaning their mouth, every tooth, every surface up to the back with kpako and toothpaste. It can be done. Okay. But it's something of that time. Yeah.
Super, because time is not my friend. A question flashed on the screen from Dr. Assain, and he was asking generally, just very, very briefly, that would be my last question here. How can oral health practices help a person with blurred speech?
Okay. First, we need to determine how blurry is the speech and what is the cause of the blurred speech. All right. What is the cause of the blurred speech? Sometimes this may not be the particular case, but I just want to give it an example. Sometimes we have people whose tongue is not really mobile. We have this tissue under the tongue that is tied somehow to the jaw, all right, and they are unable to move their tongue in all directions. We need our tongue to move in all directions in our mouth for us to make proper phonation, to make proper sounds. So if you have people who their tongue is not mobile, people who their tongues are not really as mobile as they should, so you find out that they begin to have a sore speech kind of. I'm trying to demonstrate something like that. That's a cause, okay? So, but we have to, before we can say, that's one way we can help. If we find out that's a problem, we can perform a simple surgery to release the tongue, and then after that, a speech therapist can come in to teach one how to make proper sounds and phonate properly.
Super, 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 super. Unfortunately, time not being a friend, Dr. Fechi Nkwocha, I want to thank you for the enlightenment that you have given. And may I just very briefly ask you for your last word on this subject?
Okay, thank you very much, sir. Thank you for that opportunity. So I quickly run down this so that everybody can learn one or two things on how good tips for good oral health care. We have talked about it because good oral health care leads to a longer, healthier life. So visit your dentist 2 times a year. Schedule it simple, 2 times a year for prevention, early detection of dental and medical problems like we have highlighted. And we recommend visits starting from once you are 1 year old. Once a child is 1 year old, we are ready to welcome him in the clinic 2 times every year. Please eat balanced diets. I know times are hard, I know things are hard, but please don't let your food only be bread and rice. Add vegetables, add some protein, add some multivitamins. Low salt, reduce your salt. Accountants, many of us too are getting into the middle age. Please reduce the salt in the diet. It's good not just for the teeth, but for the whole body. Make sure that you don't get high blood pressure, cardiac and other cardiac problems. And low sugar too. It will be good not just for the mouth, but for the whole body. All right. And regular exercise. Yes, exercise is needed for increased blood circulation. And once there is increased blood circulation, it also helps even to take care of oral diseases. Avoid alcohol and smoking. I have talked about that. Then brush your teeth in the morning and last thing before you sleep. In the morning to keep your friends, in the night to keep your teeth. Floss, use floss. Floss all surfaces of your teeth. And when you're brushing, use a medium-sized toothbrush with a medium textured toothbrush with a small head that can reach all surfaces of the mouth, and brush for 3 minutes each time. Changing your toothbrush every 3 months. Some people's toothbrush is as old as me.
Dr. Fechi, if I keep you to go on, I know we will not end. But we're really taking that time not being on a friend. I'd like to thank you for making time to join us and to give us this education. And I also want to thank
you.
our online participants for being so active participants. Thank you very much. ICAN on Air continues. Welcome. ICAN on Air continues next week. This time is going to be Tuesday, June 7, 2022, and we are going to be looking at this subject, creating competitive business enterprise in times of uncertainty. Creating competitive business enterprise in times of uncertainty. And we are going to be joining us as a guest, Joshua Ogbemi, MBA, FCA, he's CEO, Berkeley Consulting, amongst others. He's done quite a number of things on entrepreneurship, startups, SMEs, and how they can really be on their feet. His career span being a general manager in Total Final Health, where he did great things, including human relations, before his retirement in 2021. You don't want to miss it. I leave you with my quotes for today. Poor oral health care can result in poor overall health. End of quotes. And that is attributable to George Taylor. And so the sun sets on ICAN on air today to resume, as indicated, June 7, 2022. You be the change you like to see. Until I come your way, I remain Fechi Nkwocha, your anchor, ICAN on air. Bye for now.